This medium has been covering the Covid-19 since its first case was recorded in March 2020.
And until yesterday, when the health minister announced the Gambia's first case of the virus, it has gotten even worse.
It became a usual coverage thereafter, from the number of cases the country continues to record on a daily basis.
To start with, there is no new case or new confirmed case in the Gambia.
The fourth case is still receiving treatment and his condition remains stable. The 5 new cases have been taken to join him at the government treatment center. Currently, the country has 6 active cases.
To how businesses, schools and the economy continue to reel from the devastating impact of the virus, the dynamics became broad and unpredictable. 1 year down the lane, the Gambia has registered 153 deaths, over 4,360 recoveries and 4,939 confirmed cases as of March 2021. This is not an ordinary year in fighting the virus. A second wave has befallen nations, but scientists have worked round the clock to make what takes a decade to develop, a vaccine. The AstraZeneca vaccine became the most used after months of trials and experiments. The WHO has declared it safe and secure. Since then, developed countries have done their best to secure as many doses as they could. With the many assumptions surrounding its making, the Gambia joins few African nations that have secured the jobs with support from international partners.
We have so far covered 95% of all the health facility staff, both public and private. And we have only few pockets of private that we are trying to finish up today. And we've also seen a considerable number of people with age 65 and above, and those with hypertension and diabetes. We call them comorbidity, in the individuals.
The exercise is already underway across all 7 regions, targeting priority groups involving the elderly and frontline health workers.
We're here at the Fatou Health Clinic, where, of course, the inoculation exercise is being held for the older people and, of course, some of the priority groups that they've identified. Those living around this area have the opportunity to come here and get inoculated. And I can see that the health officer in charge is already monitoring the exercise here with some of the public health officials. And I'll just ask her, Ma, tell us, how has it been unfolding since you started?
Yeah, since we've started, many people have been coming. They have been coming. All the staffs of the facility also took their vaccines, and also our neighbors, and many people came as far as from Kotu, Fajara. They all came to take their vaccines. So we haven't had any problem since we started, and there were no side effects recorded. All the patients waited for their time. After 15 minutes, they left. But we didn't record anybody who complained of any side effects since we started.
The look here doesn't seem worrying as people wait for their turn to get the jab.
You will keep this one, and you take another one.
Some told us that they have been waiting for the whole time just to live this experience.
How do you feel after taking the vaccine?
I feel very, very fine. There is nothing absolutely.
Okay. And while others patiently wait for their turn,
You're almost going to take it now. How do you feel?
I'm almost going to take it now, definitely.
How do you feel?
I feel fine. I feel happy.
the joy of finally getting the dose means a lot to this group, most of whom are beyond 60 years as recommended.
So the age here is 73 years.
The Fatou Health Center is one of the centers offering the vaccine across the Kanifing municipality. The Sarakuna Health Center is also hard on the exercise.
It's not that painful, to be honest. People are just exaggerating it.
As officials patiently wait for the public to get their part of the jobs, the turnout here for the past 2 days was massive. The healthcare workers are doing their part in making sure everything goes orderly, says the officer in charge, David Day.
If you notice, there are 3 forms available right now. 2 of the forms stays with the health center, and whosoever we vaccinate, they are going to go with their own form, which is the card. Then at the end of the day, we are going to gather all the form, we tally it, and we are going to send it to the regional office, and then they will send it to the national data base, and everything is going to be inputted there. So during the time for the second dose, they are going to be informed as we were told.
We also witnessed some healthcare officers get vaccinated. And for them, it is a must-experience exercise, as seen in other parts of the world. While some countries rethink their decision of securing the vaccines, others are very willing to get their people inoculated. The WHO's stance on the vaccines remain as the ultimate solution to fighting the deadly virus, which until now has infected over 120 million and killed over 2 million others.
Well, taking the vaccine does not mean that you're automatically immune against the virus. It takes days and weeks before the body starts reacting to its contents. And so health officials have advised that people should continue wearing their face masks, continue observing the precautionary measures, which also include washing hands and keeping away from people, that is to say, crowds. And with that, it is hoped that the world's fight against this deadly pandemic will soon come to pass. For GRTS News, Fatou Ellika Muloshi.